네, 지금부터 오후 세션을 이어가도록 하겠습니다. 이번 시간은 일본 후쿠오카 대학병원 순환기 내과 요시나리 우에하라 교수님이 죽상 동맥 경화증에서의 HDL의 역할과 일본 무작위 인체 적용 시험에서 밝힌 HDL 기능에 대한 쿠바산 폴리코사놀의 유익한 효과라는 주제로 발표해 주시겠습니다. 교수님을 무대 위로 모시겠습니다. 큰 박수 부탁드립니다.
Good afternoon. Thank you very much. The opportunity to have my presentation in this excellent symposium. Today, I'd like to talk about, first of all, role of HDL for atherosclerosis and the beneficial effect of Cuban Policosanol for HDL function. In the randomized placebo-controlled clinical trial in Japanese healthy subjects. So it's widely known the higher LDL cholesterol level is a very high risk for the coronary heart disease. HDL cholesterol is also very important for the coronary heart disease. This is data from the Framingham study. Lower HDL group has a very high incidence of coronary heart disease. This is a schema of the lipoprotein. Lipoprotein has a triglyceride and cholesterol ester in the core of the lipoprotein lipid complex, and then phospholipids and free cholesterol cover the second layer, and the top of the surface bind to the apolipoprotein, especially in the HDL has a ApoA1 protein as a major apolipoprotein. So we usually measure the HDL cholesterol and the LDL cholesterol. This is just cholesterol concentration in the extracted HDL particle and also extracted LDL particle. Just measure the cholesterol concentration in this particle. So this is a role of the HDL particle. So usually LDL and VLDL transport the cholesterol from the liver to the peripheral cells. It needs a lot of function, such as a hormone, steroid hormone producing and others. So cholesterol also transport to the vascular tissues to make atherosclerotic changes. We also have a cleanup system of this cholesterol accumulation. So this is a HDL transport the cholesterol from the excess cholesterol in the tissues from peripheral tissue to the liver. So we never degrade the cholesterol anymore. So we have to discuss the cholesterol to the bile to the stool. So this is a major HDL system function. So HDL, this is a major HDL function, reverse cholesterol transport, to remove the cholesterol from the vascular tissues to the liver for anti-sclerosis role. So HDL has another function, such as anti-inflammation, vasodilation, anti-apoptosis, and also for the infectious disease in the morning session. So we try to the Cuban Policosanol for the HDL, to see the HDL function. So we plan to randomize control trial for the Cuban Policosanol in Japanese healthy subject. First, we randomized 72 subjects. Finally, we extract 32 subjects for this analysis. This is data of the total cholesterol, triglyceride, and LDL cholesterol. After 12 weeks supplementation with Cuban Policosanol, LDL cholesterol was slightly decreased, but not significantly. In contrast to LDL cholesterol, HDL cholesterol is significantly increased by Cuban Policosanol supplementation for 12 weeks. LDL, HDL cholesterol ratio, it's very important for the atherosclerotic marker. This LDL-HDL ratio is also significantly decreased by Policosanol supplementation. This is a HDL reverse cholesterol transport system by HDL. Cholesterol-rich forming macrophages transport the cholesterol from the intracellular to outer cell by using a membrane ABCA1 transporter. Then thereafter, ApoA1 remove the cholesterol from the ABCA1 to form the nascent HDL. Then nascent HDL remove much more cholesterol from the cells to form the mature type to go back to the liver. This is a reverse cholesterol transport system. We measure this kind of cholesterol removing ability. So we measure the HDL-mediated cholesterol efflux capacity. First of all, we take the blood from the subject. We cultivated J774 macrophages. J774 macrophages. Then we co-incubated with 2% HDL from the subject. After pre-incubation with the tritium-labeled cholesterol. So thereafter we measure the effluxed cholesterol concentration. So this is the main data of my presentation. 12 weeks of Policosanol supplementation has significantly increased in HDL cholesterol efflux capacity. So policosanol supplementation is also increasing in HDL cholesterol, ApoA1 concentration, also in ApoA2 concentration. Both of the ApoA1 and ApoA2 is the protein of the it exists in the HDL surface. Both of them increasing by policosanol supplementation. This is another factor, atherosclerotic factor, total cholesterol, LDL cholesterol, triglyceride, ApoB, glucose, and high sensitive CRP. We didn't have any changing by policosanol supplementation. So we measured some change in the HDL character. So this is measured by Professor Cho. Professor Cho's data. It's measured HDL particle size by electron microscopy. HDL2 and both HDL2 and HDL3 policosanol supplementation significantly increase the HDL particle size. HDL is much growing by policosanol. We also analyzed another method for this particle size. We divided 7 HDL subfraction by particle size using a HPLC method from smallest one to largest HDL, 7 subfraction. We measured the cholesterol concentration in these subfraction. So policosanol supplementation increase cholesterol concentration in the bigger 4 subfraction, medium to largest HDL particle, but not in the small 3 particle. So this data indicate that the policosanol increasing the not all of the HDL particle, just only for the large particle. So the mechanism is unknown, but it's a bigger one is much more bigger by policosanol. Smaller one is not so changed. So next we analyzed which subject increased HDL and HDL capacity. So we divided the 2 low and high HDL cholesterol level in the baseline HDL cholesterol level. So contrary to our expectation, higher baseline HDL baseline subject has a much more induction in the HDL efflux capacity and also in HDL cholesterol level. there is a correlation between HDL efflux capacity and HDL cholesterol level. It's a changing of HDL efflux capacity and changing of HDL cholesterol from baseline. There is a positive correlation in changing of HDL cholesterol efflux capacity and HDL cholesterol level, and also changing of ApoA1 level from baseline. So this is my last slide. So in conclusion, Cuban Policosanol supplementation for 12 weeks not only increase serum cholesterol level, but also elevates HDL-mediated cholesterol efflux capacity, which is a major function of HDL. Policosanol elevates cholesterol concentration in medium to large size of HDL, but not small HDL particle. The incidence of HDL-mediated cholesterol efflux capacity by policosanol may have activated reverse cholesterol transport and increased HDL particle size. Cuban policosanol may affect HDL in healthy subject and may promote longevity. Thank you for your attention.